right, hello everyone. This is Dr. Joel Rosen and Dr. John Thomas. We are really excited to announce the brand new launching of Your Genetic Type. How are you doing today, John?
I'm doing great. How are you doing?
I'm doing awesome because we're introducing this to everyone and giving the tools that we've put so hard work into and be able to put a new spin on the genetic component when people do genetic testing and they're confused as to what to do next. And now we've come up with Your Genetic Type. So let's kind of get into that, John, in terms of what Your Genetic Type is all about.
Yeah, so this Your Genetic Type component has been something that has been in the works for quite a while, and both of us in our practices, we specialize in using genetic components, genetic data to get insight into why somebody's suffering with chronic health issues. And so we know there's a strong genetic connection that can give a lot of insight into why somebody's not responded or why somebody's not recovering. So after looking at thousands and thousands of reports over the years, we kind of realized that there's some crossover. I mean, a lot of people that have very similar health complaints often may have some similar genetic components or some similar genetic priorities to the process. And then from that, we kind of have been able to cluster in key genetic pieces of the puzzle and really kind of streamline that into 7 core genetic types. And what this has evolved is to really kind of take away a lot of the noise, because when you're looking at genetics and you're talking about, looking at stuff online, there's a lot of conflicting information. There's a lot of information out there to start with. It gets really confusing, and a lot of people just don't know where to start. Do you start with, MTHFR? Do you start with CBS? Do you start with COMT? If you have this and you have this, and it says, take, methyl B12, this one says don't take methyl B12. It's like you throw your hands in the air and you have no idea, like, where is the starting point for you? What we've done is we've put together this concept of your genetic type based on some of the research we've done working with in clinical practice, as well as some of the other courses and teachings that we've done, of late. And based on the patients we've seen, we've really been able to categorize this down that there's 7 core genetic types that most people fall into 1 or 2 of these genetic types as their core genetic priority. And what this does is it really narrows down the rabbit holes in terms of like where one's starting point is. Because a lot of times that's the biggest question, is like, where do you start in this genetic world? Okay, if you have this genetic data in front of you, it's like, where is the starting point for you specifically? And this Your Genetic Type is what that is all about. It helps you determine your starting point, right? And we've seen this based on subjective components. And from that, based on history, based on, asking the right questions, we can a lot of times really streamline the process to determine what one's genetic type is. And then from there, it allows you to kind of really have a kind of a streamlined approach in terms of the rabbit hole or the 2 rabbit holes that you need to go down in terms of these are your genetic priorities. And then more importantly from there, what do you do about it? All right. What do you maybe consider testing to confirm the clinical relevance of that genetic priority to determine how big of an issue it is? And then most importantly is, what do you do to support it? What are the nutrient and herbal components, the vitamins, minerals that you need to actually consider taking to support your genetic predisposition, as well as the best dietary protocol you should follow? Because each of these core 7 genetic types have specific dietary protocols that usually suit best with that. And so we talk about this Your Genetic Type as a foundation, all right? And if you don't have that foundation covered or you don't have that foundation addressed, everything else you do is going to have some limitations, all right? And so by determining what your genetic type is and how relevant it is and what you can do about it, you start supporting that. Now everything else you're doing has a completely different benefit and a completely different effect on you going forward. All right. So how do we determine your genetic type? So really the first piece of the puzzles is really kind of delving in and looking at your history. And this is current history based on some of the chronic symptoms you have, as well as family history aspect, right? And by answering certain questions, you can determine what your core genetic type is. And to give you an example, some of the questions that we have in our questionnaire is, for instance, the first one here is, do you have chronic intestinal inflammation or been diagnosed with an inflammatory bowel disorder? All right. That could indicate that you're possibly a histamine type, which is one of the core 7 genetic types. The second one, do you crave carbohydrates for energy? You could be what we consider a weak cellular type. Do strong smells from cigarettes, perfumes, cleaning products, or other strong chemicals give you headache or nausea? You know, do you walk down the cleaning aisle in the grocery store and you fall apart? I hear that all the time. You could be what we call a toxic accumulation type, where your body just stores chemicals and you cannot clear them. And so you're storing faster than you can clear, and you lose oral and chemical tolerance. You have difficulty losing weight, even with proper diet and exercise. You could be a hormonal type. A lot of people are chasing the story of chasing numbers with their thyroid, or kind of in this kind of an adrenal fatigue kind of mindset, not understanding that there are genetic factors that affect hormone regulation that could be big pieces of the puzzle that are missing in terms of why your hormone levels are not balanced, or why you're not covering with adrenal fatigue aspects, and just, you know, test after test is not getting any better. And we understand now that there are core genetic factors that play into that. So by going through our extensive questionnaire, which basically has 15 core questions for each of our 7 genetic types, based on how you score in that, you can really determine which 1 or 2 of these genetic types are your foundation. And when you do that, it narrows down the rabbit holes, and then more often than not, you get the needle moving in the right direction. All right. Anything you want to add on any of that so far?
Yeah, no, everything you've been saying is great. And I think the thing that I would just emphasize is asking better questions, because we see them in Facebook groups and YouTube and feedback and social media about, hey, like, I got MTHFR, what's the best B vitamin to take?
Right.
It's frustrating for us to see that and know that those are the wrong questions to be asking. You should be asking, what is actually your main challenge? What's not working in your life, in your health, at the level that you want it to be working at? And from there, start to look at it a little bit differently. Like, yes, we want you to understand there's a genetic component, and it goes so much deeper than MTHFR, but the slippery slope is that once you understand that, you be bogged down with so much information and what to do with it. So number one, it's asking better questions, which you said, and then also streamlining it so that once you identify how it's showing up in your body and what's not working, what do we do about it? What are the best tests to do now that I have this to confirm this? And or what's the best way to eat? And we'll be coming out, you know, with how to eat for your genetic type. And then what's the best supplements? And, you know, what are the gene SNPs that I'm looking for that can confirm this and really be a companion guide? So everything you've said, John, is I'm just echoing it in a different way, in terms of it's a better question to streamline your end result and get better. That's right. What it's all about.
Exactly. So, you know, if you're listening to this and you're struggling, and you know that there's a genetic component and you're confused, or you maybe never realized that there could be a genetic component, what you want to do is you want to go to our website, yourgenetictype.com. All right. And on this website, there's a couple components to this that we want to talk about today that is going to kind of get you more information. All right. It's going to get you information to be able to narrow down these rabbit holes. And so on our website, we have a couple programs that are available. All right. We have, first and foremost, what we call our mini course, which is basically to help you discover or determine what your genetic type is. And this is a free course. All right. This is a 7-module course. It's not that long. Each of the videos in it's probably about 20 minutes long. So it's not going to take you weeks upon weeks. But what it's going to do is it's going to walk you through the key questions to ask. All right. And this is about asking the right questions. So if you start asking the right questions and answering those honestly, you're going to be able to decipher and get a pretty good idea of what your genetic type is. All right. And so that free mini course, that Discover Your Genetic Type course, is designed to kind of walk you through in 7 modules. Really, it's like 9 modules with the introduction and the last video. But the 9 videos that are in there to really help you streamline and determine what your genetic type is. And then from there, this will walk you through. All you got to do is on our website, click the program. I'll take you to this other site. Put in your email address, and it'll grant you immediate access to that course to determine what your genetic type is. All right. Now, once you determine what your genetic type is, then the next piece of the puzzle is, what are the key genes? What are the testing you need to consider? And what is the support options in terms of supplemental nutrients and dietary regimen that you should follow? And that's where we've created this Your Genetic Type Unlock course. All right. So once you find out what your genetic type is, now you need to figure out what the heck you got to do about it. All right. And so the Your Genetic Type Unlock course is going to walk you through, after you determine what your genetic type is, it's going to walk you through the key genes you got to focus on. And most of the genetic types have on average anywhere from, let's say, 5 to like 8 or 9 genes max that are the priorities. Those are the core genes, all right? And so what it does, if you got a genetic report in front of you that's pages upon pages, you're going to be able to kind of work through all the noise, work through all the fluff, and be able to go streamline strictly to those genetic components that are the core genes of your specific genetic type, and be able to put your priority there. And then now the priority from there is determining testing and supplements and dietary components that can really indicate how aggressive you need to go forward with it. Because what we found out is that these genetic type components, and once somebody understands what their genetic type is, this more often than not is a foundational component, and usually it's a missing piece of the puzzle on why people are not recovering. So if you go to the website, there's a second course there, the Genetics Unlock course. You'll click that, and what it's going to do is going to take you to the point where you can get access to your Genetic Type Unlock course. That course, it's available currently for $97. So it's over 10 hours of content that's going to walk you through. It's designed to walk you through this in a 3 to 6 week window based on your learning curve. But it's going to really hold your hand in determining, how to unlock your genetic type, or how to unlock your genetic potential, right? And so, like I mentioned, people with chronic health issues typically have clusters of genes, all right, where there's these SNPs or mutations that are very, very similar. And this is things we've seen in looking at genetic data, as well as what we've seen in clinical practice based on the chronic symptoms that people come to with us every single day, right? There's also factors from, a lot of the research out there on MTHFR, where a lot of this started for a lot of people, as well as some of the other courses that we've done, like the MTHFR crash course that we did last spring, where based on putting that course together and the feedback from patients, and then really kind of doing a lot of the research for that, that's where this genetic type concept really kind of, developed, and the birth of that kind of unveiled. So this Genetic Type Unlock course is going to walk you through those 7 core genetic types and show you what are the 5 to 8 genes that are the priorities, all right, and why they are the priorities. It will give you a little information too, kind of on the pathways and kind of how those genes are relevant in terms of biochemistry. We're not going to get too much into that, but I think you need to have a basic understanding of kind of what all that means, so that you understand how your biochemistry works and why your body is suffering the way that it is. All right. And then from those core genes within each genetic type, like I mentioned, we're going to be able to go through and teach you how to find those in genetic reports. We're going to teach you what are the specific lab tests that you need to consider to order, or ask your doctor to order, all right, be able to determine how relevant that genetic type is. Meaning, are you putting the gas pedal down fast enough to support that, because there's a lot of genetic weakness. And something I see a lot in practice is some people are taking some of the right nutrients based on their genetic type, but they've got such a genetic issue there and such a foundation need there that they are not doing it aggressive enough to get the needle going in the right direction. So lab testing components, we'll talk about the key lab tests that we recommend for each of those core genetic types. Then we'll talk about diet aspects, like what is the best diet? Is it paleo? Is it ketogenic? Is it plant-based? Are there other food components like oxalates and sulfur that maybe you have to consider based on your genetic type, which is going to allow you to stop putting lighter fluid on the fire every single day? Because if you're doing a ketogenic diet, you're not feeling good, there's reasons for that. And some people have certain genetic factors and why they can't maybe metabolize higher fat in the diet, and it's just actually driving more inflammation. And we've actually got this second concept called Eat Right for your genetic type that we're putting together that'll come out, a few months down the road here. And then we'll talk about what do you do from a supplemental standpoint? What are the nutrients? All right, what are the minerals? What are the herbal components that are needed to support some of these pathways, these key genetic variants you may have? And it will also give you our top recommended products that we like to use in our practice, and then also give you resources of where you can get those products through our Your Genetic Type website and our Your Genetic Type store, which by taking this course, you will get access code to that, which is just an added bonus, all right, to be able to learn this information. So on our website, there's these 2 courses here. The first one is the mini course, which allows you to determine what your genetic type is. And the second course is, once you know what your genetic type is, what do you do about it? All right, what are the things you got to get a little more information about, and then what do you do to support that, which gets that foundational aspect supported so that now the needle can start moving in the right direction. And the biggest thing with this is we're not stopping here. All right, this your genetic type concept is really going to explode because we can correlate this to a lot of things. And so right now I'm working on an ADHD and autism course. We've got an MTHFR course that's specific to the MTHFR component, that if you want to learn more about that and how that plays into things like fertility aspects and fatigue components and detox components. We'll have another course specifically to histamine intolerance, that if you're a histamine type, you may want to take that histamine course because it's going to go more in depth into histamine intolerance as well as mast cell activation components, and delve you deeper if that is your core genetic type, which you determine through these first courses. Putting together a mini course on oxalates, putting courses together on leaky gut and chronic fatigue, and all that pinpoints back to this core foundation that everybody has a genetic type, that if they understand that and support that, they get the needle moving in the right direction for the first time in their lives.
Yeah, it's awesome, John. And even going beyond that, like thinking about some of these epigenetic factors like heavy metals and molds and chemicals and pesticides and sprays. And if that's you and you realize that's what's causing your health to fall apart, you need that core course of what your genetic type is so that you can layer in the foundations to get to the root cause of the problem. And a lot of people will have what they call those paradoxical reactions or those Herxheiming reactions, when really it's not a Herxheiming reaction or a paradoxical reaction whatsoever. It's just the lack of information as to what your genetic type was, and not fill up the foundations first or empty the overflowing buckets first.
Right.
And then once you get to that, now you can go deeper. And we're really excited with this foundational product, which we feel everyone should have going forward. So we will be other questions, John, or other topics you want to bring up now, or any other pieces of information for anyone who's listening to this right now?
No, I think we covered it. And I think really the next steps is people to go to yourgenetictype.com and register for the free mini course. It's free. Go on there, watch those 9 videos that walks you through how to determine what your genetic type is. Fill out the questionnaire, score it, determine what your genetic type is, and from there, then make the decision to take the next steps to learn about what to do about it. Okay.
Right.
And like I said, this is something that to me is we know the genetic component has been talked about for a little while now, and we know that a lot of people are scratching the surface because it can get very in depth. It can get very confusing. All right. It's a lot of information. It's a lot about biochemistry. And to the normal person out there, it's just information overload. And so what we've really tried to do is streamline it down. And really, this is what I try and do in practice. I try and make this as simplistic as possible. And by doing that, this is kind of how this evolution of your genetic type came about, is because, hey, how can we make this in bite-sized pieces that anybody can understand, that is going to allow them to understand that, hey, there are some foundational components that are not being addressed. There's missing pieces of the puzzle that is causing that water level to rise over the edge of the bucket and spill onto the floor and create a mess day in, day out. So go to yourgenetictype.com, register for the mini course. If you're ready to go ahead and jump in and start taking that Your Genetics Unlocked course as well. It's going to walk you through a lot of information, and for $97, it's a no-brainer in my opinion. And then also follow us on Facebook and YouTube and Instagram, because you want to be kind of in the loop based on some of these updates that come about, as well as some of these additional courses that we put together that may really be specific for you. Because, if there are certain genetic components, like if you're a toxic accumulator type, there's a high likelihood that oxalate metabolism can be a factor in this. So you maybe want to go a little bit more in depth and learn more about that oxalate aspect and how to make that a lifestyle change. And so we're going to have some spin-off courses that kind of funnel off of this. And then also more core things that deal with things like chronic fatigue and kids on the spectrum, that go a little bit more in depth on some of the things that we do in practice that address those situations, that more importantly get you to kind of put the right things in place to address the foundational aspects and start asking and answering the right questions going forward.
Yeah, and so just to give the viewers some direction, make sure we will put a clickable link on this video, so you can click on the video directly from wherever you're watching it. And also wherever you're watching it, there'll be a clickable link in the comment section as well. So then that way you can get access to the free course, and you can get access to the Genetic Unlocked Foundational course. And then just as a bonus, we are giving a 30-day free access to the membership site where we plan on working more intimately with you guys, having your own private Facebook group questions with us, John and myself, answering your questions, going through case studies, seeing other people that are like you, and this is what they did. These are the test results they had, and these are the supplements we recommended and the nutritional strategies we implemented, and this was the result, and here's their testimonials. And you'll be able to be sort of looking over our shoulder with that free access as well. So our goal is just to provide you with as much information on what your genetic type is, how it's ruining or creating a major debilitation in your life, why you haven't been able to move the needle up until now. I mean, I meet with a lot of patients on a day-to-day basis, John, who say, and I'm sure like you, my doctor's never mentioned anything like this. I've never heard anything like this before.
Every day, every person.
Yeah, it's a shame. It's a real shame. But you know what? We know that the people that are watching this are decisive, and they know that this is a problem that can't go on any longer. And also they're resourceful. They know, like, hey, if it's gotta be, it's gotta be me. You know, it's gotta be me who figures this out. And we're giving you the companion guide to do that. And that's what this is all about. So make sure you click on the link and go to yourgenetictype.com and use all our tools. And we'll be super excited to hear your feedback about how much it's changing your life at the end of the day.